Hello, everyone, and welcome to today's webinar from the Society for Implementation Science and Nutrition. My name is Rebecca Heitkamp, and I'm SISN's Vice President and Development Counselor. It's a real pleasure to open today's webinar about scaling up micronutrient interventions in Nigeria, how the SISN framework is being used to guide implementation research. But before we dig into that content, I did want to share a little bit about our new strategic plan. Next slide. As some of you may recall, last year, SISN launched its new strategic plan. And this plan is really building on the foundation that had been established in the 5 years before. So in our first year strategy from about 2016 to 2020, we were really focused on both developing and operationalizing the SISN framework for implementation science in nutrition. And we've had a few opportunities to apply that, and you're going to hear a really exciting way that that's being applied right now in Nigeria. Next slide. Also, during that period, we really got to engage and develop a really rich knowledge hub. So if any of you have been able to visit the knowledge hub, it's become a place where all sorts of resources related to implementation science in nutrition have been collected. And we were really glad to see that over those years, we had an uptake in our audience in terms of who was subscribing to our newsletters, who was following us on social media. So we feel like those resources have been reaching people. Next slide. And we've gotten a lot of great feedback. You know, it's been exciting, especially to see our colleagues working more in the field and on the ground, shouting out to the ways that SISN and SISN's work has been supporting them. Next slide. So we went into a process, though, of revisiting our strategy. Right when we were coming into COVID, we had our old strategy was expired, and it was actually a great opportunity for us to stop and try to really listen and hear where is it that SISN should be going over the next 5 years. And as part of that process, we both engaged and reached out to members. We had surveys that went out, but we also brought on a panel of implementation science practitioners and researchers based in low and middle income countries to be our special advisors during that process. And so while we focused on listening, we came away hearing some things about what might be needed for successful implementation of nutrition actions. So the fact that we need strong linkages and effective communication across stakeholders and levels of implementation, that implementation research activities really need to be embedded within programs rather than parallel or kind of done remotely, that there's a need for training and expertise to apply implementation research and to really get it to be and implementation science and to have it be embedded. And then finally, that we do need more effective dissemination and exchange, but especially locally, where people are trying to address some of the different same implementation challenges, that we need to be able to foster more exchange there. And so coming out of this listening session, we really were able to envision a role for SISN, especially in fostering networks and knowledge exchange around those who are engaged in implementation science and nutrition. Next slide. So the news is our vision and our mission remain unchanged. We want to see a world where actions to improve nutrition are designed and implemented with the best available scientific knowledge and practical experience. And SISN's mission in achieving that vision is to convene, advocate, disseminate, and promote dialogue among scientists, policy leaders, government officials, funders, and practitioners to advance the science and practice of nutrition implementation worldwide. Next slide. But what looks a little bit different and honestly just more refined is where are we really focusing that? So, you know, we were really focused on generating that framework and finding ways to operationalize that in our first plan. And now we're hearing there's a real need to focus more on connection, helping people foster these networks of exchange, especially more within their local context, of capacity building and capacity strengthening so people feel empowered and ready to carry out implementation science within their context, as well as an ongoing need to be a source for communication and creating a platform where people can exchange and share both the how and the findings of what the work that they're doing. So we really feel like if we're able to pursue in these areas, we'll be able to enhance the scale up and operationalization of implementation science in nutrition. Next slide. So we've got some ways, some practical ways that at least on the vision and in our strategy, we're proposing about how this might happen. These include forming networks and really supporting the formation of more localized networks for implementation science and nutrition. We've heard people say that global conferences or perhaps having something alongside a global meeting can really be helpful and encouraging to those who are able to come and attend. We do want to make sure that we're working in this area of capacity strengthening and training, and to continue in this knowledge exchange role that we've been playing, which really connects then across these three goals that we have. Next slide. So what I'm excited to say is I think that today's webinar on scaling up micronutrient interventions in Nigeria is really kind of a wonderful precursor of what it is that we're hoping to have happen. So you're going to hear all about how this framework and learning that we have from the first 5 years of SISN were applied, but also I think it's a great example of some of the things that we're trying to achieve moving forward. So one thing you'll hear is that we had a technical advisory group of SISN members, really that idea of fostering networks and connections. And then SISN has been playing a role with dissemination support, including putting together this webinar. So really excited to see where things can go from here. And now I'm going to hand it over to Shannon King, who's going to be moderating today's focus webinar. Thanks.
Hi, everyone. Thank you, Rebecca, for your opening remarks and for setting the stage for today's webinar. As Rebecca mentioned, my name is Shannon King. I'm a SISN counselor at large and co-chair for the technical advisory group that's supporting this innovative project in Nigeria that we'll learn more about today. Just a little housekeeping to start. Today's webinar is scheduled to finish at 1 p.m. Eastern Time. So for the next 30 minutes, we'll hear a presentation about the Nigeria micronutrient powder and multiple micronutrient supplementation implementation science study. After the presentation, you'll have the opportunity to pose your questions during a 15-minute discussion period. To that end, please type your questions and comments into the question box in the GoToWebinar control panel. You may submit your questions at any time during the webinar, and I'll do my best to pose as many questions as possible as time allows. If you experience any sort of technical issues, please also type your questions within that question box, and our staff will help address these. We're also active on Twitter and encourage you to chat and engage with us through our Twitter hashtag, which will appear in the chat box, #InvestInIR. Finally, a recording of the webinar will be made available after the session. Before I introduce our guest speaker, we'd like to get a sense of who's in the audience today by asking you a few questions. Momentarily, you'll see the first question appear on your screen, which is going to ask you to describe your current role. So I'll give you about 30 seconds if you could click on your current role, then we'll review who's in the audience today. Perfect, and now we'll review the results. Great, so it looks like the majority of our audience today is researchers, with a scattering of kind of program and policy implementers, as well as strategic leaders within the organization, and a handful of other folks who identify with kind of other roles. For our second question, if you could best describe the organization that you're primarily affiliated with, so whether that be academia, NGOs, UN agencies, industry, self-employed, or other. Great, and can I see those results? Great, so it seems like the majority of folks on the line today are from NGOs, whether that be local or international, as well as some folks in the academic area and kind of the consulting worlds. And for our last question, if you could just indicate to us how important is implementation research within your current role? 1 being the not important at all, and 5 being very important. Great, so if you could see those results. Wow, so implementation research is really important to a lot of folks within this audience. So with that, I'm really excited to now introduce our speaker for today. Olutayo Adeyemi is our speaker today, and she is a nutrition consultant in agriculture, health, social protection, and education sectors. Her experience supports the translation of scientific evidence into household and community impact, primarily in Nigeria, and that includes contributing to research, to policy and strategy development, and nutrition capacity strengthening of institutions. Her research focus is primarily on understanding nutrition behaviors from community to policy levels and how to leverage on such knowledge to create an enabling environment for nutrition. Tayo is also an associate lecturer or adjunct professor at the Department of Human Nutrition and Dietetics at the University of Ibadan in Nigeria, where she teaches nutrition policy and co-supervises postgraduate research. She holds her PhD in nutrition with a policy focus from Cornell University. So with that, I'll hand it over to you, Tayo, to hear a bit more about our project today.
Hello, everyone. I'm delighted to have this opportunity to share what we have been working on here in Nigeria. And I would like to thank SISN for organizing this webinar. I would also like to appreciate everyone who has joined us today for taking the time to do so. I'll be presenting on how we have been using the SISN framework to guide implementation research on micronutrient interventions in Nigeria. This research is being led by the Nutrition, Agriculture and Health Initiative in collaboration primarily with Sight and Life and with other partners that I will share. So the key elements of today's research include an overview of micronutrient powder intervention, iron-folic acid supplementation, and multiple micronutrient supplements for pregnant women. We're looking at research in Nigeria and how this the research contributes to ongoing work in implementation science generally. We have inadvertently, because it wasn't because SISN was a research partner, we followed the SISN framework for implementation science in nutrition, as well as the 5 domains of implementation, and that is what I'll be presenting on today. And so at the end of this presentation, I expect that everyone present will be able to describe ongoing implementation research in Nigeria. I also expect that everyone present will be able to identify at least one advantage that the SISN domains of implementation framework has over comparable frameworks. Okay, like I mentioned earlier, Sight and Life is leading this work with Nutrition, Agriculture and Health Initiative, NAHI. It's also being done in collaboration with DSM, UNICEF Global and UNICEF Nigeria, the Society for Implementation Science and Nutrition, and the Federal Ministry of Health. I'll talk later about the different roles that each of these stakeholders have played. In terms of the SISN's classification scheme of implementation research, this research focuses on implementation, so the implementation, improving iterative improvements of programs, as well as scaling up. And it is particularly looking at nutrition-specific interventions. So micronutrient supplementation is a nutrition-specific intervention, and the 3 interventions we are looking at fall into that category. So to provide a bit of context of Nigeria, I know some people may be familiar with Nigerian context. We may have a lot of local attendees, but there will also be people who are not familiar with the context. So I'd just like to provide a brief overview of what the Nigerian system looks like. So Nigeria operates a federal system of governments, and this means there are 3 levels of government. So we have the federal level, we have the state level, and we have the local government authority. There are 36 states and a federal capital territory, which is not part of any state, and that is Abuja. And then there are 774 local government areas across the 36 states. The number of local government areas vary from state to state, depending on the geographical size as well as the population of people in the states. And then we have 6 geopolitical zones. So what you can see here, the map of Nigeria here on the screen is showing the 36 states. The Federal Capital Territory is right in the center. And you have the colors show the geopolitical zone. So we have the Northwest, the Northeast, the North Central, the Southwest, the Southeast, and the South-South. Now, states are grouped into these zones based on the similarity in culture, similarity in language, agroecology, and livelihoods, but there's no administrative government at the geopolitical zone. So it's not an administrative level. It's just a way of grouping states that allows you, states that are similar together. So sometimes when it's not possible to look at the situation in each state, then surveys look at the situation in each geopolitical zone because they know that there are similarities across the states in those zones. So now there are 3 northern zones and 3 southern zones. And what we have is that the malnutrition and other development indicators are generally worse in the northern part of the country compared to the south. But the south still bears a significant burden. It's just not as bad as the north, to put it in a sense. So constitutionally, the responsibility for all the nutrition-related sectors, health, agriculture, education, sanitation, water, all of those sectors, the responsibility is shared across the 3 levels of government. The federal level develops policies and monitors implementation of policies, and then they disseminate to states, advocate to states to adopt the policies, but the states have autonomy over whether or not they actually adopt the policies. So the states design their own programs, even around when they decide to adopt policies, then they design their own programs and the components of those programs. But then the local government is actually the one that implements, because primary healthcare workers, teachers in public primary schools, environmental sanitation officers, many of the agriculture extension officers, and other relevant cadres like that are staff of the local government level. And so any challenge at the local government level affects implementation of policies and programs. And because of the federal system and the autonomy of states and local governments, states can actually decide not to do anything. Local governments are autonomous, but to a large extent, states provide some oversight, more oversight over local governments than the federal does for states. But local governments can still choose not to do anything, even if just by not providing enough staff to carry out a particular activity. And what the autonomy means is that ministries at each level of government are entities of that level of government. And so the State Ministry of Health, for instance, reports to the state government. It does not report to the Federal Ministry of Health. It's a separate entity from the Federal Ministry of Health and completely independent. So in terms of the research background, micronutrient deficiencies are really high in Nigeria. Results of the 2021 National Food Consumption and Micronutrient Survey show that 62% of children 6 to 59 months old have anemia, and 41% of adolescents. The survey also showed that among women of reproductive age, 55% of them have anemia, and 86% of pregnant women have anemia in 2021. Now, over the years, several studies have found repeatedly that poor diet quality is a major cause of malnutrition in Nigeria. and a major cause of micronutrient deficiencies. In 2018, the Nigeria Demographic and Health Survey showed that 56% of women of reproductive age achieved the minimum dietary diversity score, which reflects likely micronutrient adequacy of the women's diet. For children, as recent as 2021, 12%, just 12% of children 6 to 23 months old consumed the minimum dietary diversity. And the situation has persisted like this. Even in 2008, it was about 10%. In 2018, it was about 11%. And so consistently over years, children have been fed a diet that is low in diversity and low, likely inadequate in micronutrients. And the available evidence shows that micronutrient deficiencies are likely to remain high in the absence of supplementation and other interventions, because 72% of the Nigerian population could not afford a diet that meets all nutrient requirements in the 2020 State of Food Security and Nutrition in the World, SOFI report. And in the 2022 report, it shows that the affordability of healthy diets has even worsened since 2020. And so the need for micronutrients supplementation and other micronutrients interventions are really high and are likely to remain very high in the short to medium term. Micronutrient powder and multiple micronutrient supplements, so MNP and MMS, are priority interventions that have been that are promoted by the World Health Organization to reduce micronutrient deficiencies in high burden countries like Nigeria. For the multiple micronutrient supplements, it's expected that this will gradually replace iron-folic acid supplementation, IFAS. But WHO says that for scaling up either MNP or MMS, it needs to be guided by research. It shouldn't just be interventions that country implements. And so for MNP in Nigeria, it commenced in 2015 with formative research. It commenced in 2 northern states, but the rollout and the scale up has really been low. Currently, it has been introduced in 24 states as at 2022, but stockouts are very common across states, and the intervention is often not delivered according to national guidelines. When there are stockouts, then children miss months when they ought to have taken MMP based on the schedule. The other thing is that in many states, it's not all local government areas that are implementing the micronutrient powder intervention, just a few local government areas. Then for iron-folic acid supplementation, it's being delivered through the primary healthcare system in all the 36 states and the Federal Capital Territory. And recently, the Federal Ministry of Health decided that they were going to look at how to gradually scale up MMS, so gradually replace IFAS with MMS. But as I'll talk about, work on that is still in the early phases. And so based on the guidelines by the WHO, there's really a need for Nigeria to develop operational guidelines and a scale-up strategy for both MNP and MMS. And the guidelines, like I mentioned, need to be based on implementation research. So the objectives of our study are to understand the factors that are effective in introducing and scaling up MNP and MMS in Nigeria, and the conditions under which these factors are effective. So there is, based on the literature, there are 9 critical elements that have been identified that are important for implementation and scaling up. These factors are having a clear vision or goal for impact, the characteristics of the intervention, the enabling, having an enabling organizational context, contextually relevant strategies for the intervention, champions and incentives, operational and strategic capacities, optimal financing, adequate governance, and monitoring, learning, and accountability. And so based on these factors, and these factors came from a review that was conducted by Stuart Gillespie and colleagues in 2015. So we wanted a framework to guide this research, and we wanted a framework that would enable us to be able to address all of these 9 elements, but a framework that is also adaptable, so doesn't force us to have to collect data in a certain way or collect specific pieces of data compulsorily, depending on whether or not it will be appropriate in the context. And so we found 4 frameworks. We considered 4 frameworks, and we didn't do an extensive search. So this was not like a review of all the frameworks that were available. We considered 4 frameworks. So one was the Enabling Environment Framework by Gillespie et al. In 2013. Then we considered the framework that highlighted the 9 elements that I already mentioned. That's the Gillespie Impact on Nutrition Framework from 2015. Then we also considered the framework of Factors Driving Nutrition Commitment by Baker et al. A 2018 publication. And then we considered the SISN's Domain of Implementation Framework. And all of these 4 frameworks met the criteria of being adaptable and able to comprehensively assess the 9 elements. And all these frameworks, essentially, if you look at the kind of information you get from them, you are able to talk about the 9 factors that are influential in scaling up an intervention. The differences in the framework generally lies in the language that they use to label different dimensions. So the language and the sort of constructs that are part of the different dimensions they have, as well as whether they group dimensions together and how they group different dimensions together. And so we selected the SISN framework, the one that shows the 5 domains for implementation. And honestly, this framework wasn't selected because SISN is a research partner. It was because it's actually very appropriate for the work we're doing, and I will explain why. So this framework highlights 5 domains whose characteristics, capacities, and dynamics and fits affect implementation quality. And so these 5 domains, the first one is the objects of implementation. And the objects of implementation simply refers to the characteristics of the intervention that is being implemented. And then you have the second domain that refers to the characteristics of the individuals and organizations that are implementing these interventions, and their interests, their motivation, their influence, and other characteristics of the individuals and organizations. The third domain is the enabling environment. Enabling environments includes governance, financing, stakeholder dynamics, and a lot of other things. What kind of stakeholders are involved, and factors that enable or prevent stakeholders from getting involved, for instance, are all part of the enabling environment. So, for instance, if you have issues around the supply chain and infrastructure, those kinds of things are part of the enabling environment. And then you have the fourth domain, which looks at the individuals, households, and communities and their characteristics. So what are the needs of the individuals, their felt needs, their perceived needs, and all of that, their resources, their capacities, their culture, and other factors that affect the individuals, households, and communities that are the expected beneficiaries of the interventions. And then we have the fifth domain, which includes the processes through which the intervention is being implemented. And it can include the processes for initiating the intervention, planning, delivering the services, and ensuring sustainability. And all of these 5 domains affect the implementation outcomes, whether the implementation is successfully implemented or not, and whether it's successfully scaled up, and ultimately affects the nutritional status of the beneficiaries. So the reason why we selected the SISN's 5 domains that affect implementation quality was because it groups the various elements according to readily identifiable aspects of implementation. So it doesn't group the different elements according to issues or themes, but rather according to this defined aspect of implementation. For instance, if you say, oh, we are working on the objects of implementation, we're working on characteristics of the intervention. In a context like Nigeria, where the people who design the policies and essentially decide what the characteristics of the intervention should be, are different from those who are going to be planning the intervention and deciding what the implementation processes should look like, for instance. And that's also different from those who are going to engage with the beneficiaries and who are actually going to deliver the services. We consider that this framework that separates that groups these different factors according to domains that we can actually use to make recommendations to the different stakeholders at the different levels of government was more useful for us than having one that just dealt with the issues and then we will present results according to issues, but then it doesn't speak to any particular stakeholder directly, or different stakeholders have to identify their role within the results. And so for the method, so even though the SISN framework is very useful, it's not very specific about what should be measured for each domain of implementation for a research topic. And so we looked at how to use the framework. And so this is a strength for us in the sense that this is where the adaptability we wanted comes in, but it also creates a challenge for research guidance. Now, I had used this framework for a previous study, and what we had done as part of that study was to conduct a review of each domain and to identify critical factors that will be important to understand for each domain. And so what we did for this work was to take the initial review and then revise it using additional literature. And so what we did was that for the objects of implementation, we were able to we looked at the ability of policies to guide implementation, the extent to which guidance is provided for each of the 5 domains of implementation. And we did that by a desk review of policies and guidelines using a code that was developed a priori. And then for the domain of the implementation, implementing organizations and individuals, we are looking at the interest and influence of various stakeholders and how they are linked among each other. So who is giving funding to who is sharing information with who, where does the authority exist within the among stakeholders. And we're doing this using a desk review as well as key informant interviews. And then for the enabling environment, we are looking at the evidence generation and use. We are looking at coordination, both multi-sectoral and vertical. We are looking at advocacy and funding. And we are also doing, so the additional tool here that is different from the other domains is we are conducting a frontline worker survey, and we're also doing focus group discussion for a bottleneck analysis. And then for the 4th domain, we are looking at how the potential beneficiaries demand the interventions, as well as the barriers to the intervention demand. And we are doing this with a secondary analysis of GHS data. We are doing a primary beneficiary survey to fill in the gaps that exist from the secondary data, as well as key informant interviews. The delivery mechanisms and implementation processes, we are looking at the supply of interventions. We are looking at the capacity, various types of capacity. We are looking at the fidelity with which interventions are being delivered. And we are looking at barriers to intervention supply. And we are doing this in addition to tools I already mentioned. We are also doing frontline direct observation, so actually watching the health workers deliver the interventions. And then we will be looking at the study population at six different types or six different study population. That's where we're drawing our sample for. So at federal level, we are looking at the stakeholders involved in designing the policies and guidelines for MNP and MMS and IFA. And then we're also looking at those involved in the supply chain. At state level, we are looking at those involved in operationalizing the national policies and managing the program implementation, so providing technical assistance to the local governments. And 2 states have been selected for this: Adamawa in northeast Nigeria and Ondo in southwest Nigeria. Because of our time, I will not be able to go into why these 2 states were selected. At the local government level, we'll be looking at those involved in implementing the guidelines and their direct supervisors, as well as supply chain actors at the local government level. We are also looking at frontline workers who actually deliver the interventions to the beneficiaries in the health facilities. Then at the community, we are looking at frontline workers who work in the community, as well as informal service providers at the community level. So not necessarily people delivering the intervention, but informal people providing informal health-related services. And then we'll also be talking to community leaders. And then at the household level itself, we'll look at the target beneficiaries of the various interventions, as well as the influencers of target beneficiaries. So our target beneficiaries are the women, pregnant women, and women of children under 5, and then the influencers are the husbands and the grandmothers. So we started this work formally in May, and we started with stakeholder consultations and development of protocol. We had an inception meeting in August, and then we started working on data analysis and desk review from September. We submitted the protocol for ethics approval in September, and the approval came in October. We have started primary data collection in December, and we are collecting it in phases for several reasons, and also because some of our like the survey, for instance, we have several processes that need to happen, and so we don't want to delay some of the interviews until we're ready to go to the field for the survey. So we've collected some data, and we are currently transcribing, translating, and analyzing, while we are also planning for additional data collection. We plan to complete analysis, report writing, and everything by June, and have the validation then, and then disseminate the findings of the research. And so the contribution of this work to implementation science is that we recognize that implementation science, implementation of intervention often has a lot of failures. But a lot of times research looks at challenges related to either the implementation processes or oftentimes maybe with the beneficiaries. A lot of times research does not look at all the domains that can affect implementation. And so this research, we hope that it will provide a holistic view of factors affecting implementation and highlight the value of assessing all domains rather than prioritizing one or two domains. And so the methods are expected to be helpful in contexts where intervention coverage has been persistently low and the specific contributory factors are not clear, or they may cut across different domains. It's also expected to be helpful where different groups of stakeholders have primary responsibility for the domains of implementation. Like the example I gave of Nigeria, where we have one group of stakeholders, like one level working on policy making, but then it's another level who has to think of how to operationalize those policies, and another level that actually implements the policies. In conclusion, this research provides an opportunity for us to understand how to effectively scale up MMP and MMS in Nigeria. The SISN domains affecting implementation quality has been very useful for guiding comprehensive inquiry into recognizable action areas within the Nigerian context. I would like to appreciate all the partners, the main partners that have been involved in this work. So Sight and Life, TSM, UNICEF, with NAHI and the University of Ibadan. SISN, yes, SISN has been very key in initiating even the process of bringing all the different stakeholders together, conceptualizing the research and everything we have done so far. I'd like to thank the Federal Ministry of Health. The Federal Ministry of Health has been really cooperative. And when we started it and we said yes, we approached the Federal Ministry of Health and said this is what we want to do. And they said, okay, let's see what you propose. And they provided constructive guidance on this. This needs to happen. You've not considered this. You've not planned to do this. You need to think about doing this as well. And it has been working with the Federal Ministry of Health has actually been a game changer for this work. We're grateful to the National Bureau of Statistics. They're providing guidance for the survey, primary survey we're doing with frontline workers and beneficiaries. And they are also doing the sample selection, so household listing and everything that needs to happen to select the samples. The Nutrition Society of Nigeria has also been very supportive. A lot of our the core project staff were grantees, implementation science and nutrition grantees of the Nutrition Society of Nigeria. And then we also had members of the society who have been active in implementation science and nutrition across the different parts of the country. They form part of a group that provides advice and support to the core project team. And then we have the state's primary healthcare development board. So for Ondo states, it's the primary healthcare development board, and in Adamawa state is the primary healthcare development agency. A lot of the work we have been doing in state has been through the guidance and consultation with these stakeholders as active participants, both contributing to the research as well as going to be the users of the research. And so they have taken this on as something that is going to be very useful for their work. And they have really been instrumental in helping us shape how we are going about this work and being able to reach our target beneficiaries. And I really like to thank my team, the core project team. So I have Ahmed Awal Saliu, Olufolakemi Anjorin, myself, and Olutayo Adeyemi. 4 ladies, 2 men, and yes, several of them were full-time on this project, and they have gone over and above several times to ensure that this work is well done. Thank you very much for listening, and I'll hand over to Shannon to proceed.
Great. Thank you so much, Teo, for your engaging presentation. I'm seeing the questions starting to come in, but again, feel free to throw your questions into that question box and we'll ask as many as we can in the next 15 minutes or so. While the questions are coming in, I do just want to take the liberty of posing my own question. So, Tayo, you've explained so many different data collection methods and data sources to really kind of holistically and comprehensively assess the implementation of these interventions. So I guess I'm just wondering if you could expand a little bit more on how you think you're going to kind of bring all these findings together, whether that be through analysis or through presenting of the findings, to really package it all as showing all the different elements of implementation.
Okay, so thank you very much, Anna, for your question. So we plan to do at least 2 things. So one is to look at the domains of the 5 domains of implementation. And so I couldn't show that, but we have the factors that we're looking at under each domain. And we have a code book that we're using for the interviews and qualitative work. And then, of course, the surveys fall into specific domains as well. We have questions related to the different domains within the survey and all of that. And so when we analyze the data, we are going to be separating the results according to the part that falls into the different domains to be able to describe each of those domains for these 3 interventions. The other thing that we plan to do is that based on the findings for the 5 domains, then we are going to synthesize the results, also looking at the 9 factors that affect the scale of interventions. And so we will sort of have the results also organized according to those 9 factors that affect implementation. And depending on the audience, we will decide which pieces of the research to present to them. So which pieces of the findings to present to them. So we target what we present to our audience. Thank you.
Great, thank you. And kind of a similar question that was posed by Jenny Bush-Halen. She says, thank you very much for your presentation. Can you explain more about your primary and secondary research questions? Are you trying to answer based on your desk review to kind of what will influence a more effective scale up, or if you can just clarify a little bit what your research questions are?
Okay, so I mentioned that the primary research question is to identify the factors that are effective in rolling out and scaling up the micronutrient interventions and the conditions under which those factors are effective. And so what we are looking at, so I didn't provide information about our study locations, but Adamawa State has been implementing MNP since 2015 when it started in Nigeria. Ondo is just started implementing in 2021. Ondo has started to implement MMS in all its local governments. Adamawa is still implementing IFAS. And in Adamawa, for instance, the sources of the interventions vary across different local governments. And so we have taken this into consideration in selecting the local governments where we are working. And the idea is to be able to look at in which locations have this intervention been received. There's high acceptance of the interventions. Mothers are using it like achieve a high number of days, and children are also taking the MMP as scheduled, and then identify the factors that support the acceptance and the effective implementation of the interventions, and then compare them to context where the interventions are not doing as well. And so based on this, to be able to look at what needs to happen if Nigeria, the different states and local governments are going to be able to effectively scale up the interventions. So I don't know if that answers the question. So, yes, I can talk more about it. Thank you.
Yeah, I think that does. So from what I'm understanding, it's a little bit of looking at where it's being well implemented and not well implementing and dissecting those elements of what's contributing to that successful implementation.
Exactly.
So I have another question here from Santosh Kumar, and it says, anemia is pervasive, but we know the potential solutions to prevent and cure anemia. The biggest challenge is the behavioral issue, low uptake and use of fortified products by households. So how can we increase the demand and use for fortified products?
Okay, so thank you very much for that question too. So in terms of fortification, so we are not, this study is not looking at fortification, but there's a lot of work in Nigeria ongoing around fortification, increasing the coverage of foods that are already fortified, increasing industry compliance to fortification, improving packaging so that nutrients are not lost along the supply chain. There's nutrients from fortified products, and also identifying new vehicles to fortify. So a lot of that work is ongoing, but with the high prevalence of anemia among pregnant women, for instance, and also the high prevalence among children, and the fact that diets are poor, and a lot of it is linked to poverty. I didn't mention that, but incomes are really low. Affordability is a big challenge. And so we cannot eliminate supplementation. So even while we are working on improving fortification and improving access to nutrition foods, supplementation is going to be very important in the short to mid-term. Thank you.
Great. And so I think also that question relates a little bit to the supplementation. So we know that kind of the supplements are effective at improving micronutrient status. So can you speak a little bit to kind of how to increase the demand and the actual use of these supplements?
Okay, so that's one of the things we are looking at in talking to the households, their influencers, and also community leaders and all of that, and looking at communities where the intervention is readily accepted compared to communities where they're not. This webinar is not about presenting results, but we have already started to understand some of the factors that affect how many days that some of these supplements are taken, whether or not these supplements are taken for sufficient number of days or according to the schedule. Well, yes, so that's one of the things we are going to find out, what affects adherence and all of that. Thank you.
Great. So I guess we'll just have to hang on until you're able to present some of the findings. Another question is, would you be able to clarify the delivery platform of MMS in Ondo?
So that is, honestly, it's a question I can't answer yet because we haven't collected the data that will allow me to be able to answer that question. And even if we had, we hadn't planned to share any results at this webinar. So yes, we didn't have any information about the MMS in Ondo a priori because it's not yet a national intervention. It's based on the autonomy of states. So some states are partnering with Vitamin Angels actually to implement MMS in certain states. And so it's not a national intervention. It's based on the arrangement with individual states. And so we couldn't get any information about the interventions without going to the states. And so it's really part of the data we are collecting as well. So yes, hopefully when we have the dissemination of results, then everyone will have access to this result, or probably we'll have maybe another webinar prior to the full dissemination. I don't know, but yes, it's not something that I have that information right now.
Great. And a question a little bit about kind of overall MNP and MMS implementation. So this was asked by Mohammed Yarima. And the question is, do you have any idea on the time frame of when we might expect kind of MNP and MMS to be implemented in Nigeria? I know it's implemented in some states, but not necessarily others. And is there a time frame on when you think these interventions might be rolled out?
So yes, I can't answer that question honestly because it depends on several factors. I know that the federal level is providing support for states to start implementing the interventions, but the readiness of the states to also start is a key consideration. And so perhaps again, when we are done with the research, then we will be able to answer that question. For now, it's not something that I can say that I can put a time frame to. Thank you.
Great. I know it's a little hard to predict the future and what's going to happen. One final question before I think we have to wrap up, where I might be able to get two in. David Pelletier says, great overview, Tayo. Thank you so much. Can you please share your plans for dissemination within the country and also for global audiences?
Okay, so for dissemination within the country, so we actually plan to have sort of like a workshop at the state level. So there's one plan for federal level, but then also we plan to go back to the states to engage with the state level stakeholders around the results. And then we'll have policy briefs that are available, state-specific briefs as well as one for the country. And then for the global audience, we'll have a webinar, one-on-one webinars to disseminate the findings, and we'll also have journal publications. I'm not sure we'll have publicly available reports, but definitely journal publications. Thank you.
Great. Well, we would look forward to seeing those. And I think a few final questions that are coming in. One more broadly a little bit about fortification in Nigeria, which I know is not specifically what the project is about, but contributes to the overall micronutrient supplementation efforts in country. There's a question from Santosh Kumar saying, given the high rates of anemia, has the use of double fortified salts ever been tried through school lunch programs in Nigeria?
So I know that when I was in school, really, and this is several years back, I know that there was talk around it being tested in some part of the country, but honestly, I don't know what happened to that intervention. I tried to find out about 2 years ago or so when I was working on another project, but I couldn't find anyone who could provide an answer to that. So maybe I'll check again with the Ministry of Health, but I don't know. I know that there has been talk of using double fortified salt in Nigeria. But currently, what is widely available is the iodized salt only.
Great, and it seems like a lot of folks on the line are antsy to see your research, and there is a question asking if you'd be able to share the findings from your desk review, and if that's something that you could make available.
Okay, so yes, we'll have to ask SISN Life, DSM and UNICEF if they're comfortable with those results coming out earlier. Yes, well, it's not something we can share. We hadn't planned to share it at this webinar.
Perfect. Well, we'll make note of the people who are asking for it, and we can hopefully circle back to them once we get a clear answer if we're able to share those findings before all the other data is collected. So it looks like we've run out of time for any more questions. Tayo, I just want to say thank you for your incredible presentation. It's so wonderful to see how you've adapted the SISN framework to really comprehensively assess the implementation situation, and as you said, holistically look at it from all the different areas. It's incredible to see the amount of work that you and your team are doing and how many different data collection methods you have and data that you're collecting to really piece apart why it is being implemented well or not being implemented well in different areas of Nigeria. I did also want to say thank you to everyone for your participation and your insightful comments. It's been a pleasure to moderate the session today. We hope that this webinar has been informative and thought-provoking. And if you have any questions or comments, please feel free to contact the Society at info@implementationnutrition.com. Please do visit our website to stay up to date on the Society activities, to learn more about implementation science and nutrition. We're also active on social media and welcome your thoughts, comments, and engagements through our Twitter and LinkedIn pages. Once you leave today's webinar, you'll receive a very brief survey on the webinar, and we would appreciate it if you could take a moment to provide your feedback. You will also receive a follow-up email in a few weeks with a link to today's webinar's recording and a URL to the PDF of the slides. On behalf of SISN, thank you so much for joining us and have a great day.